I recently got a new batch of Cantharidin in the office, and my wart treatments got infected 2 times. Hello, welcome to Podiatry Practice Mastery. My name is Don Pelto. I'm going to go over the $1,000,000 minute here. So I had a couple of patients recently after we got some new Cantharidin in the office. I used to have patients leave it on till the following morning. Now I'm starting to have them take it off in 4 to 6 hours because they got this big blister, and I got a call this weekend, and they sent me a picture. And it had like pus underneath it, so they popped the pus, and the infection went down. But I did have another gentleman that I put it on his wart, and he actually had a bad infection from it and had to get admitted to the hospital. So like these are things that I think, depending on the quality of the products that we use. So I think the old Cantharidin got a little bit old and wasn't as potent, and this newer one is more potent for us, or maybe just even the vendor. So have to be careful. Be careful, because that can ruin my day and ruin my weekend with getting those calls. They're concerned. It was easy to treat, but it's just a frustration. Okay, let's go into the day here. The most valuable patient today was the Shockwave patient, a 51-year-old female. She had number 4 out of 6 for Shockwave, and then she was scanned for orthotics. What I usually do is I tell patients that they're going to be scanned on the 3rd visit. This was actually the 4th visit. And the way I explain it is I explain the Shockwave is good at getting rid of the pain, but to help it not come back and help the mechanics of the foot, specifically high contouring orthotic on that thickened fascia, can help reduce the re-injury rate for the patient. And that's kind of how I'm doing the orthotics. So that was the most valuable patient. Next patient was another Cantharidin. This is a second Cantharidin doing for this patient, 40-year-old female. Next was a 46-year-old man, bilateral foot pain, got x-rays. He actually went to Six Flags, which is Great America, one of the amusement parks here, and he wore aquasocks the whole day. And I've heard injuries due to flip-flops. I've never heard injuries due to aquasocks. But he was wearing aquasocks, and his feet were really hurting, But for a 46-year-old guy he has a 2-year-old daughter, he's just walking around too much, and that's why his feet hurt. And it took a couple weeks to get better, but now he's better. But I don't think he had anything else. Next was a 53-year-old female with a left fracture follow-up. She had a fibular fracture after PT. She's out of the global, so I was able to get the office visit. She also had some fissures through her heels, and I just reminded her of how to take care of the fissures. My routine tends to be the sleep and heel socks at night, and then during the day or in the morning, the 40% urea cream with a pumice bar for that occasionally. Next was a 55-year-old female. She came in because her Cariflex fell off. This would be a least valuable patient. I guess I got an office visit out of it. Had to put the Cariflex back on. She's a nice patient, but those kind of glut the schedule a little bit, and I'd like to get more of those on Marjorie, my nail tech schedule for that. Next was a 76-year-old female. She had a new patient. She had a left matrix on both edges. She's had a couple of ingrowns before in the past, and she opted for that. She had a couple of just INDs before. Next was that plantar fasciitis, number 4 out of 6. There was a lot of Shockwave yesterday, so let me go. Just might as well do all the Shockwave here. So plantar fasciitis, 4 out of 6. There was a Achilles tendonitis, a 60-year-old female, number 2 out of 6. There was a 68-year-old man with number 4 out of 6, posterior tibial tendon. The other one was Achilles tendon. Next was a 38-year-old female with left ankle pain. She had arch pain. She had number 1 out of 6. Now, this is a funny one. I have some patients. Some just always want a discount, and this was one. And this is one that had 3 phone conversations with Blue Cross Blue Shield, wanted their Shockwave to be covered, and thinking it would be covered, and this and that, and oh boy. So this one, but these ones do also do Taekwondo with my kids, and so I wanted them to feel like they're getting a deal, so I did both feet, because she does have both arches, and I did both, and I only charge for one. I occasionally do that. I feel like it doesn't really take me extra time, and I don't always double dip on these bilateral cases. Next was a 57-year-old female, number 3 out of 6 for Achilles tendonitis. Another was a 45-year-old female with left plantar fasciitis, number 5 out of 6. And those were a lot of the shockwaves of the day. Now I'm going to get back into the other stuff. Next patient was a 42-year-old female with bilateral bunions and hammer toes, and she was wondering about if she had to do anything because her mom has a really bad hammer toe. So I really just talked to her about shoe changes, did x-rays. My shoe recommendations are usually anatomic shoes like Lems, Topos, Ultras, and I always say shoes first and then correct toes second, and then surgery after they try those things. Next was a 25-year-old man. This gentleman, I think he's a medical student or a postdoc or a PhD student. He had a little black line on his left fifth digit. He was concerned about like a melanonychia. I took a nail sample. I think it was more from rubbing. He also had a little mole on his right fourth toe, and I didn't even biopsy it. It was just so small. I took pictures of him, and I'm going to see him in a year. Next was a 61-year-old female. She traveled all the way from New Hampshire because she had ingrown toenails, and she saw that we were like one of the only ones that actually did Onyfix. And so she came all the way for that. Now, yeah, mind you, these were kind of curved toenails. They were curved in on both edges of both great toenails. And I did the Onyfix. I do not do a ton of Onyfix. I do it occasionally when they need it. Hers has really never gotten infected, but they just bother her. So I put Onyfix on bilaterally, and then she'll come back when they fall off. That's when I used to have them come in every 3 months, and then I would apply another one proximally. But at this point, I try to keep it on as long as it stays on, and if it falls off, I don't charge them to put it on. I kind of guarantee it for 3 months. If it falls off, then I just charge an office visit for that one. Next was a 64-year-old female with a right foot lesion, and I kind of did x-rays, did offloading. She had a kind of a prominence on the extensor hallucis longus, just proximal to the first med head. So I think she has rubbing and bowstringing of the extensor that's causing like an ulcer. I think it's because she was wearing slip-on shoes and then just pushing her foot in there and it was hitting on that area. So I made a little offloading pad. I felt like I was in school again. Because I don't do a ton of padding. I did like some felt and offloaded it and stuck it on her foot with the elastoplast and put right and left on it. I felt so crafty. Okay, next was a Cutenza consult. This was a 72-year-old man. He has non-diabetic neuropathy. You know, these ones are just like willing to do anything for their neuropathy. He was thinking about going to Colombia for stem cell injections. He has seen a number of different providers. He's doing some vibration plate. I don't exactly know what it is. Some vibration plate where he pays $250 just to vibrate his feet. He's considering a nerve stimulator, and he was referred over from the nerve stimulation pain management at a hospital for us to do Cutenza. The problem is they didn't preface it that Cutenza usually isn't covered for non-diabetics. And so I'm going to try to get it covered because he's on all these other medications and things like that. And he can feel. So it's like he has symptomatic painful neuropathy. And so we'll see if that's covered for him. I'm going to try to. We've had some patients, some insurances that cover that. Next was I don't think I talked about this one. This is one of my favorite shockwaves of the day. This is number 3 for the fourth digit fracture. This is a fracture, non-union, that's been there for a year and a half. That didn't get better. Really swollen digit. After the first and second, she's already feeling better. She's on number 3 for this focused only. So when it's a fracture, it's a little toe. Come on, it's a small area. I'm not going to do radial on that. It's just but she's doing focused only for that one. Next patient was a 40-year-old female, had forefoot pain, possible neuroma. She does have a lot of tight equinus, and so I talked about anatomic shoes, and she's going to do the Pelto special, night splint foam rolling, morning stretch. I'm going to see her in 1 month and see how she does. And the last patient of the day was an 82-year-old male for a right equinus as well. He had painful Achilles, once again, foam rolling and stretching. This guy, he was great. He was one of the pioneers with pickleball. So he's like got this pickleball shirt, and I started talking about pickleball, and he's like, yeah, in Massachusetts. He was like 15 years ago he started to play pickleball, and he learned it from a guy that played it in Florida, and then he made his own little pickleball courts. Like they went to the rec center and asked them to do the pickleball courts. Anyway, he was really, I think the main issue is he was tight, and he needs some help with that tightness. I did not do a night splint because he's not having any pain getting out of bed in the morning, but he's very, very tight, so I had him work on foam rolling, stretching, things like that. And if it doesn't get better, then I will do probably physical therapy for him. Okay, so that was the day. I hope you guys found this beneficial. I am putting together kind of a 6-month challenge for some people that are interested. If you want to learn more, you can go to podiatrypracticemastery.com. There's I think there's going to be something up top that says challenge, or it'll probably be /challenge to find that. Looking for some other practices that want to bring their practice to the $1 million mark and beyond. And I was thinking, I think the best people for this are people that are already busy. I think there's two. I did a podcast recently. I think there's two groups of people. In terms of practices, not people in general, but just practices. Some that are they're supply constrained, meaning they don't have enough supply of patients. Those are harder to deal with. Those are harder to, like, I don't know if you get the best benefit from the mastermind because you're not busy enough. You don't have the number of patients that you can optimize. If you're still trying to get in patients, that's your whole focus, is like marketing, is AdWords, newsletter, getting referrals, everything else like that. Once you get to a certain amount of patients, then you're looking to go from like 600,000, 700,000 up to the $1 million mark. And then, so it's doing that transition. Once you're totally busy and you don't have any more room for patients, then I feel like that's a better area to help with, to optimize your practice production. Okay, so those I think that would be the better people for this challenge. Okay, once again, hope you guys enjoy this. Have a great day. Talk to you tomorrow.